Barcoding systems in healthcare. Any store, regardless of the items being sold, have to keep an inventory of their products to meet the buyer's demands and know the certainty of having items and when to obtain more. Inventory used to be an inaccurate, time-consuming job. Once stores started to expand and became in charge of more items, managers wouldn't have the time or resources to take inventory. Something had to be done to support the growing of retail business. In 1948, Norman Joseph Woodland, a 27-year-old graduate student from Drexel, began to help streamline this process. His first idea would have different patterns of ink that would glow under ultraviolet light. That didn't work out very well due to printing cost and ink sustainability. His second idea he got from Morse code. The Morse code idea was as simple as turning the dots and dashes into thick lines. Woodland decided to change the lines to concentric circles like a target, hence the name bullseye code, so it can be scanned from any direction. Satisfied with this work, he began to patent it. IBM offered several times to buy the patent, but it wasn't at a price Woodland was willing to agree to. In 1962, Philco met their price and bought the patent. A few years later, Philco sold it to RCA. In 1971, at a grocery industry meeting, RCA was given demonstrations of their bullseye barcode. RCA was pulling a large crowd, and the IBM executives noticed and became worried they were missing out on a potential market. The IBM executives found Woodland, the original inventor of the barcode, and transferred him to North Carolina, where he helped develop the Universal Product Code, or UPC. RCA stayed with the bullseye code and began an 18-month test in a grocery store in Cincinnati. The code limited its usefulness because the printing presses would often smear the ink in the direction of the printer, which would render the code useless. But with the UPC, any extra ink would just smear at the bottom and no information is lost. IBM made Universal Product Code 1 and was chosen by the public. On April 3, 1973, the UPC was adopted by the nation. The code is split into 6 different digits on each side. The first number is always 0 except for meat, produce, and other items that have a variable weight. The next 5 are the manufacturer's code, and the 5 digits after that are the product code. The last digit is a check digit to make sure all the numbers were scanned correctly. On June 26, 1974, everything was finally finished, and in a supermarket in Troy, Ohio, a pack of chewing gum became the first retail item ever scanned. Ever since that day, barcodes have moved into different industries, such as Army, science, and healthcare. Automated data collection in the healthcare industry is no longer a convenience, but now a necessity. Healthcare providers need a cost-effective technology to ensure accuracy and patient safety. Maintaining an inventory in a hospital is often overlooked, but by having barcodes, inventory supply and equipment use can be controlled with ease. Stockroom supplies would be the consumable goods and items, and check-in, check-out applications track reusable items like lab results and diagnostic tools. Registration used to be a tedious and time-consuming task, but now all it requires is a nurse with a mobile cart connected to the hospital's network. The nurse records all the patient's information and prints out a wristband and a chart with matching barcodes. This allows doctors and nurses to have immediate access to the patient's record just by scanning the code. Once the patient is admitted, the staff can then scan the barcode of the patient's wrist to verify it is the right person and begin checking vitals and updating their chart. When it comes to medication, the nurse will scan the barcode again to confirm the right patient. This decreases the chance of a fatal mistake of improperly administered drugs. After confirmation, the drugs that are given are scanned and automatically added to the patient record for future reference. Barcode uses could differ between departments. Radiology departments will have many notes and films which need to be coded. Radiology will then have a check-in, check-out system. Every note or film that leaves or returns will be scanned, allowing the department to know what doctor is utilizing what film. That ensures the tracking and return in a timely manner. The laboratory is one of the most critical places to accurately track every test tube and sample to confirm that it is affiliated with the correct patient. By coding every vial, it can be tracked to the hospital, and it will greatly reduce the risk of giving incorrect lab results. The pharmacy will hold several medications at one time. By using a barcode printer, you can print multiple labels at a time and affix them to the medication. This results in a faster checkout and much more accurate way to track the inventory. This provides the most efficient service possible by improving productivity and accuracy. After knowing the history of barcodes and how far it's come since the 1940s, someone would think it would only continue to improve, but it really hasn't. There isn't much room for improvements. There have been small improvements to streamline the barcode process, but the actual technology hasn't changed. Smartphones can now scan barcodes and look up prices so customers can get a better deal. And there are now healthcare barcode scanners that are disinfectant ready to prevent the spread of diseases between patients. But those are all just drops in the ocean. The technology of barcoding will not change anytime soon. It works great, and it has been since 1974. We can only hope to expand the technology to more industries and make small adjustments for improvisation rather than change it.